Hi, I'm reporter Katie Suman from 60 Minutes, and this will be a special with Johnson & Johnson Company. We are joined here by Alex Garcia, the CEO of Johnson & Johnson. Thanks so much for being here, Alex.
Thank you. I'm happy to be here.
Tell us a little about your company's mission and vision of Johnson & Johnson.
Yeah, our company's mission is caring for a world one person at a time, and we believe this inspires and unites the people of Johnson & Johnson. We embrace research and science, and it bring innovative ideas, products, and services to advance people's health and well-being. Employees of Johnson & Johnson family of companies work with partners in the healthcare to touch the lives of over 1 billion people every day throughout the world.
I know your company is in the consumer, pharmaceutical, and medical devices sectors. How are you doing currently financially?
As of quarter two of 2017, we had sales of $18.8 billion, which is a 1.9% increase. And I'm going to go into each section individually. The consumer highlights: as of the second quarter of 2017, we had sales of $3.5 billion. And pharmaceutical highlights: we had sales of $8.6 billion. And medical devices, we had sales of $6.7 billion.
As of this year, what is your current market share?
All right, so as of the second quarter of 2017, we have about 42.75% of the medical devices and diagnostics market. We actually run about 52.25% of the skincare market and 21.12% of the total consumer products market. All right, in our consumer segment, we offer products that deal with baby care, beauty, oral care, and women's health. In our pharmaceuticals, we deal with immunology, infectious diseases, and neurosciences, just to name a few. And in our medical devices, we deal with cardiovascular machines, treatment for diabetes care, and orthopedics.
We'll be right back after this short commercial break.
J&J Consumer, caring for more than 1 billion people around the world, helping them live healthy, vibrant lives. From the early years to the later ones, we're there for you. Everything from baby care to allergy care to pain relief and anti-aging, iconic brands that take care of you your whole life. Products for health and healing, well-being and beauty will help you feel better and look better. By combining breakthrough science and consumer insight, we deliver solutions that healthcare professionals trust and consumers believe in. It's an approach that helps families be well and stay well, and allows us to make a world of difference by caring for one person at a time. All that caring makes us one of the largest and fastest growing consumer healthcare businesses in the world. With many of the world's most beloved household brands and more than $600 million spent on innovation. And we don't plan on slowing down. So all you scientists, engineers, quality assurers, marketing sales execs, and world changers out there, if you want to innovate innovation, if you want to make mobile healthcare happen now, if you want to impact many lives in your lifetime, then chances are you've got J&J DNA. We're driving healthcare into the future. Johnson & Johnson. Over 275 operating companies across 3 global business segments are ready to help you take your career just about anywhere in healthcare. Be vital.
Can you discuss with us a little bit about your competitive rivalries that you have?
Yeah, so we at Johnson & Johnson, we provide products such as Tylenol, Neutrogena, and Band-Aid. Pfizer, who's a top manufacturer of healthcare products just above us, they provide products such as Listerine, Lubriderm, Visine, and Neosporin. Merck, a pharmaceutical company that we compete against, they have products such as the Gardasil shot and Nasonex. And Novartis AG, another pharmaceutical company we compete against, they provide Ritalin and Clorazil. So we believe Pfizer is more of a threat than the other two companies. And that's because they're a high profit margin, but they are also in a different market segment than the other two. Pfizer is considered one of the top manufacturers of healthcare products, and but we at Johnson & Johnson, we have a wide variety of products in different markets that gives us a competitive advantage over them.
Can you talk to me a little bit about your threats of new entry?
Yes, of course. So the threat of new entrants to us is very low because the barrier to enter the markets that we're in are very high, and the barriers to entry for us, like we have a lot of product differentiation, and the technology patents that we have to stimulate innovations are exclusive to us, so it's harder for other companies to manufacture the same products as we do. And we are also on a very broad scale. We have 275 different companies that we own in 60 different countries.
How do you plan on tackling the threat of the buyer?
So the first step to tackling the threat of the buyers is by building a large consumer base, and this diminishes the bargaining power of the buyers, and it opens opportunities to streamline sales and the production process. Another way to tackle the threat is to innovate and create new products and diversify our portfolio even more, because consumers are never happy with the same old thing. They always want something new.
I know there's a lot of different suppliers that deal with your same type of market, so how do you guys differentiate yourselves from others?
Okay, so we have very numerous suppliers, but we have a sign-up sheet on our website that any business can sign up and see if they can fit into our plan. And what we do is we run like a supplier diversity kind of thing. So like we have a lot of minority-owned and small and large businesses that are our suppliers, run by veterans, some run by the LGBT community.
I'm aware that there are many different substitutions that people can choose instead of Johnson & Johnson. Can you talk to me a little bit about that?
Okay, yeah. So our biggest problem actually is the manufacturing of generic pharmaceutical drugs, because when some of our patents run out, generics are created at a fraction of the cost. For example, we can talk about the drug Risperdal. We did $3.5 billion in sales in 2005, and we did $1.2 billion in the first quarter of 2006. But our patent expired in December of 2007, and generics were made available by October 2008, which severely hurt our sales for that product. And a lot of generics are being created by many different firms.
We'll be right back after this short commercial break.
J&J Pharmaceuticals, the Janssen Pharmaceutical Companies of Johnson & Johnson, a group that shares the Janssen name and vision to make healthcare better today and tomorrow. Our scientific discoveries are making it possible for people to live longer, healthier lives. So what are Janssen's creative minds working on? Innovations that transform how diseases are prevented, treated, and cured. Medicines that have the strongest potential to improve the greatest number of lives. We focus on some of the most devastating diseases and complex medical challenges of our time. Oncology, helping millions of patients fight cancer and hopefully one day end it. Treating HIV and hepatitis C so people can live with hope instead of fear. Vaccines, developing treatments to protect the world from the next big epidemic. From mental health and immunology to cardiovascular and metabolic diseases, if there's an unmet medical need, chances are we're working on it, dreaming about it, doing whatever we can to solve it. That's why we invest more than $5.1 billion per year in pharmaceutical research and development. We are one of the largest pharmaceutical and biotech businesses in the world, with an industry-leading pipeline that has the potential to yield more than 10 new product filings and 25 significant brand extensions by 2017. We bring together the best science, sharpest minds, and an openness to collaborate. So all you scientists, engineers, quality assurers, marketing sales execs, and world changers out there, if you want to innovate innovation, if you want to make mobile healthcare happen now, if you want to impact many lives in your lifetime, then chances are you've got J&J DNA. We're driving medicine into the future. Johnson & Johnson, over 275 operating companies across 3 global business segments are ready to help you take your career just about anywhere in healthcare. Be vital.
Hi, welcome back to 60 Minutes. I'm here with Mary Beckerly, one of the board of directors of Johnson & Johnson. Thanks so much for being here.
Hi, Katie. Thanks for having me.
Can you tell me some strengths about the company?
Sure. Our worldwide sales are continuing to grow, and we have ongoing plans for further geographic and market solution expansion to sustain our sales growth. Also, many of our portfolio brands are admired by a wide range of customers who regularly return to these products for reliability, quality, and value. Johnson & Johnson's brand portfolio has a strong presence within each of the product categories. We have deep assortments and large number of brands to choose from, which is helping us occupy large shelf space in stores, resulting in high visibility in the market. Furthermore, our strategic merger and acquisitions with various consumer, healthcare, and pharmaceutical companies like Neutrogena and Pfizer, consumer, healthcare, and many more, Johnson & Johnson have created a pool of technological and operational advancements, which is helping our company in our further growth.
Can you tell me a little about your supply chain and also your business model?
Sure. So within our supply chain, we have an active and robust distribution system meant for making the products available to retail outlets, supermarkets, and medical stores, even in the most remote rural areas. Okay, and for the business model, Johnson & Johnson uses a flexible business model that allows us to adapt quickly to market changes and trends, focusing on entrepreneurship, problem-solving techniques, and innovation. The business model has led to numerous innovative medical devices, pharmaceuticals, and other consumer healthcare product releases, further differentiating our company from our competitors.
Can you tell us some of the weaknesses about the company?
Sure. Unfortunately, like many companies, we've had some litigations. This has affected our brand image, which could spread negative word of mouth about our company. We've also had dependence upon the success of launch products. Many new launch products are vulnerable to the uncertainty of regulatory review. And then we've also had reliance on small molecule drugs, which is impacted by generic competition. Our small molecule drug sales have declined in 2008 to 2012. The necessity of finding replacements for billion-dollar products as they mature represents a daunting task for us as a company. And then the pharmaceutical side of our company has been criticized for their high prices, just like in many other pharmaceutical companies, which many consumers have trouble paying, so this has led to concerns over corporate greed. Also, recently there have been some protests against some of the Johnson & Johnson products, including the pelvic mesh implants, which have led to a damaged reputation. Our company is dependent on certain products and small niche drugs for the pharmaceutical industry, which can also limit us. So all of those things together can present possible weaknesses, but we're working very hard to fight against that.
What do you see as some of the opportunities that Johnson & Johnson has?
I'd say that with the diverse portfolio of solutions we have, there's many untapped opportunities for cross-selling products. This includes cross-selling between medical devices, or pharmaceuticals, and diagnostics related to caregiving and specific therapies for oncology, diabetes, and other health issues. There are opportunities also for further acquisitions to strengthen our position, which would further diversify our product portfolio, expand our territories, and add to our resources and research capabilities, which would grow our revenue streams. Also, right now, some countries are banning generic medicines, which would give us an advantage. We also have the potential to exploit the biologics market. The addition of further biologics, for example, therapeutic proteins or antibodies, to our portfolio can serve as a buffer as small molecule patents are expiring, which will drive the further growth of our company.
What do you see as some of the threats for Johnson & Johnson moving forward?
I'd say probably the fight against harmful ingredients is a big one. Many times, our products have been found to have ingredients which could be carcinogens. Similarly, these ingredients have been banned in the US and other countries. Repeatedly, this fight against these harmful ingredients has affected our brand image as a whole. And also, we've had a little bit of a negative impact of product recalls. Johnson & Johnson has had the misfortune of having to recall more than 40 medicines. The company stands to take a hit to its reputation, competence, and integrity. Another threat to Johnson & Johnson is the intense rivalry. Due to the presence of strong global competitors who provide alternative and substitute products, we're facing stiff competition. Also, local players who are offering generic products are also affecting our business. And then lastly, a threat to us is the many new launch products that we're setting out that are very vulnerable to the uncertainty of regulatory review, and the ultimate market benefits may vary substantially from the forecast. Therefore, a reliance upon our launch products can potentially represent a threat to our outlook.
We'll be right back after this short commercial break.
J&J MD&D. A few letters that represent lots of smart people making a mighty big dent in the world. How? By touching people's lives everywhere, every day. So what do we have our hands in? We're in just about every OR and ER in the world, helping to save lives in all kinds of ways and all kinds of surgeries. Orthopedics, giving people's joints a second chance. We're treating people with cardiovascular disease to help hearts everywhere keep on beating. Helping people really live with diabetes, not just manage it. Allowing eyes to see near and far and everywhere in between. You see, we're doing things and going places no one thought possible. We're the largest medical technology business in the world. That's big. Double-digit growth in emerging markets big. We're leading the market in, well, a whole lot of places that help a whole lot of people. So all you scientists, engineers, quality assurers, marketing sales execs, and world changers out there, if you want to innovate innovation, if you want to make mobile healthcare happen now, if you want to impact many lives in your lifetime, then chances are you've got J&J DNA. We are driving medicine into the future. Johnson & Johnson. Over 275 operating companies across 3 global business segments are ready to help you take your career just about anywhere in healthcare. Be vital.
Outside of Geisinger Hospital, where we are going to meet with Board of Director Mary Beckerly again. Welcome back. Thanks for being here, Mary.
Thanks for having me, Katie.
Can you tell me some of the key success factors about the company?
One of our first successes is our adaptation of entrepreneurial values in the operation of our company. It helps us retain our edge within the marketplace, and it also provides us with a core value for our large company in operation and coordination around the world. We also provide a variety of programs to meet our employees' needs. This is both convenient for employees, and it also is one of the largest factors driving engagement within our company, even more so larger than our financial incentives.
Can you now tell me some key failures that you've had with the company as well?
Some of our biggest failures are attributed to scandals, government investigations, device and drug recalls, and lawsuits. This has led to a loss in customers and revenues, making us reposition ourselves in the minds of customers to again gain trust and loyalty. The Tylenol crisis is one of the most challenging recalls we've had to deal with. In 1982, 7 people in Chicago died after taking extra-strength Tylenol laced with cyanide. Unknown suspects took the products off the shelves, added cyanide, and returned the product to the shelves. We had to recall 31 million bottles and lost over $100 million. In 2002 to 2003, we had the Risperdal controversy, where we had thousands of lawsuits and criminal fines of $334 million for our questionable marketing tactics. Our company encouraged staff to illegally target doctors and clinics treating children and the elderly. The FDA refused to approve doctors to prescribe these drugs for any use. They were very dangerous and could cause an increased risk of stroke and heart-related problems. Another recall we had to do with hip implants. In 2010, DuPuy, one of our medical device subsidiaries, was one of the first manufacturers to use metal hip designs. The metal ball and cup components rubbed together, which released metal ions into the bloodstream, causing metal poisoning within the blood. We had to recall all hip plants, totaling to $2.5 million. The last failure for our company that I'm going to talk about today with you, Katie, is the talcum powder scandal. In 2016 and 2017, a woman claimed to have gotten ovarian cancer from using our Johnson & Johnson baby powder. Fortunately, we won our appeal of $417 million in the verdict. The judge could not find any convincing evidence that we were the cause for this cancer and that the award for damages was excessive. So they cited errors and jury misconduct. Unfortunately, the woman died shortly after the verdict.
On behalf of 60 Minutes, I wanted to thank you and Mr. Garsky for your time today.
Thank you for having us, Katie.
No problem. After speaking with Johnson & Johnson, 60 Minutes feels as if they can give some recommendations to the company moving forward. The characteristics of the industry influences the executive decisions of J&J greatly. New developments in pharmaceutical products are also extreme, providing the opportunity to growing the existing product portfolio, which should continue moving forward, and development into new functions of medical devices and diagnostics. This all provides new markets to entry, which will result in business growth. Another recommendation that we can make is promoting cooperation and cultural exchange within the company. Independent offices working as standalone units should be continued. This provides the opportunity to develop concepts with cultural considerations and is important when taking a product to new global markets. That concludes our episode today of 60 Minutes. I'm Katie Suman. See you next time.